Hello, I'm Dr. William Morgan, and I'm here with Chambers Medical Group. We're going to speak today about injuries that occur in motor vehicle accidents and other types of injuries. And today we're going to focus a little bit on spinal injuries, specifically soft tissue injuries that are called herniations or bulges, so disc bulges or herniated discs, period. The patient frequently will come and present with hip pain, and that's been spoken about in the past. And what is occurring is the patient has a spinal injury affecting different areas of the spine. So just to go over the different areas, this is obviously the patient's head here, and the patient's neck is below it. We call that the cervical spine. And the cervical spine has all these yellow things that are coming out here that you can see, and those are called spinal nerves. So the spinal nerves come out of the spinal canal from the spinal cord, which is behind these openings here in the back of the spine, period. And the spinal nerves innervate. They come from the neck, and they'll go down the arms and innervate the arms, meaning they cause you to feel sensation when you're touching. They cause you to feel pain when you're doing something that's uncomfortable. And they also innervate the muscles in the arm, which then allow you to grasp and do the functions that you need to do. Frequently, we'll see the same thing in the lumbar spine. And let me just go back a little bit to the thoracic spine. The thoracic spine is called the thoracic spine because it's connected to all the ribs, and you can see where all the ribs come off of the spinal canal in the back here at the thoracic spine. Usually this is not a place where we see a lot of injuries, although we do see herniated discs on occasion. And the reason why we frequently see less injuries is the stability that's rendered to the spine by the rib cage itself, because those ribs are all filled with muscles, as you all know, and that renders more stability. In the lumbar spine, we have more of a free segment here, and that's the low back. So people with low back pain will frequently have issues with the spine itself or the muscles that come off the spine. And like the neck, we see all these nerve roots coming out. The nerve roots in the thoracic spine will innervate around the front of the chest. So people with herniations in the thoracic spine will have pain going around the front of their chest area at different levels, depending upon exactly where the injury is. Down in the lumbar spine, we'll see the ramifications of any injury in the legs. And this is why I spoke recently about some of the problems in the hip joint, or the misconception that there's a hip problem. These form a plexus of nerves that go into a big nerve that everybody's heard about called the sciatic nerve. And the sciatic nerve will come out of the front of the body through this foramen and go down the leg. So people with sciatica will frequently get it based upon some entrapment of the nerve in the spinal canal. And this will manifest itself as it becomes the sciatic nerve, and people will have pain shooting down the back of the leg. So the way it turns into a nerve is, let me show you over here. This is what a vertebral body looks like, or one of the spinal vertebral bodies, as you can see on this area here. If we cut that in half, the very front is the vertebral body, where we know where things are there. And then on the top of that is a disc. So these gray areas represent the discs that occur between the vertebral bodies, and their shock absorbers is what they act as. There's two parts of it. One is the annulus, which is a very thick and grizzly-like material that is kind of rubbery in consistency and acts as a shock absorber. In the very middle of that part of the disc is something called the nucleus pulposus. that has the consistency of, I'd say, crab meat. And what happens in a bad injury, there's compression on that segment, the disc, and the middle of this will squirt out to some degree. And I'll show you on a better model a little bit later. And as it comes out, and again, this is the vertebral body. This is what you feel in the back of your neck or your back, where you can feel the very tip of your spine there. And what happens is there's nerve roots that come off the spinal cord, which is in the spinal canal, and they get pressure on it. So here's the disc here, and if that were to have a herniation, it would press on the nerve root. Even though it's happening here in your spine, your brain's going to tell you it's happening in your leg, whatever nerve is coming off and what level it is at. For example, in your lumbar spine, if the disc is lower, you'll feel it more towards the bottom of your foot and the side of your foot. If in fact it's higher at L1 or L2, you'll feel it more on the lateral side of the upper thigh. So this forms what's called dermatomes that innervated by these spinal nerves. And so if you have compression on the nerve, your body's going to think it's happening in your leg. And this is why we do studies like MRIs. Plain x-rays, if you just perform plain x-rays, they show the bone very well, but they do not show any soft tissues. So bone x-rays are only valuable to us really if we're looking for a fracture of the spine itself. That's why we do MRIs, which show soft tissues, and they would show to me if there's a disc herniation pressing on that nerve. In that case, then we have to do different types of treatment modalities, which we'll go into at some other time.